and health policy analyst now, Anushay Hossain. She is the host of the Pain Gap podcast. Thanks for taking the time to be with us, because we were talking a lot about this study in our meeting this morning, and it says that patients really typically have better outcomes with female doctors. What have you seen?
Thanks so much for having me, Chris. And I wish I could say that I was surprised, but this study really confirms what women already know. Our pain is not taken seriously, our symptoms are not believed, and these dismissals can be deadly. The Journal of American Medical Association actually found that women in America wait an average of 29% longer than their male counterparts to be seen, and are twice as likely to be referred for a mental condition than actually a medical a medical diagnosis.
Why do women wait longer?
Women wait longer because in addition to the pain gap, Chris, there's a credibility gap. Women are simply not believed about our bodies. We have a long history, of course, of the legacy of hysteria in medicine, and it still impacts women's diagnosis and health today. What's really interesting about this study, though, is that the findings are global. They're not unique to America. Women and patients in general fare better with women doctors and women practitioners, and the pain gap is basically international. It's not something unique to the U.S.
And you have male doctors who go through all the schooling you need to be credentialed as a medical professional, and yet, according to this study, and a lot of what you're saying now, male doctors seem to downplay the severity of illnesses. Why is that?
That is an excellent question, Chris. A lot of it has to do with the knowledge gap. A lot of research on women and women's health is still not done properly. And women and people of color, women of color, are also excluded from clinical trials, even today, even in modern time. So to give the doctors the benefit of the doubt, a lot of them simply do not know. They have not been trained. They have not been taught in medical school. The recent conversations around menopause found that menopause is not something that doctors is not a mandatory course that pre-med students have to take. Rather, it's offered as an elective. So basically, for too long, Chris, we have been defaulting women's health and women's bodies to men's health and men's bodies, when we actually need more research, more education, and also we need to increase the amount of women in the medical field, but also people and women of color. A similar study actually came out earlier this year that found that people of color and their children fare better when the doctor is also a person of color.
What's standing in the way from there being better representation in the medical field then?
Oh, that is a great question, and what I have dedicated my life's work and research to. There's a lot that can be done. First of all, we have to believe women. This is one of the hardest things. It sounds very simple, but this is one of the hardest things that we have when it comes to women, healthcare, and research. Women are simply not believed. We have to start by believing women, and then we have to include more women and people of color in clinical trials. And lastly, we need more people of color and women in the medical field, period. But what is needed is an honest conversation about our implicit biases, about race, and about how these things show up in our healthcare system.
And for the male doctors who are part of this study, and this study saying that they need to do a better job, how can they get there?
Well, first of all, what they're doing by just admitting that there's a problem and admitting that they can do better is a massive step. A lot of times we are taught, not to question the doctor, not to be disrespectful with the doctor. But in my research, I have found that one of the most important people in your healthcare team is you. You are the expert in your body, of your body. You are the expert of your systems. You know symptoms. You know yourself the best. So having an open communication with your doctor, and if you find that you are being dismissed by your doctor or gaslit, find a new practitioner, find another provider, because these dismissals, Chris, can be deadly. Women are paying with their lives.
Yeah, it was certainly a talker, but a story that has and should have people's attention, and especially when they go to the doctor. Health policy analyst Anushay Hossain, thank you for your time and your insight.
Thank you. Thanks for having me, Chris.